we've got a very sort of complicated show to do this morning, and we're really kind of focusing on the prevalence of and I'm not even sure if I'm using the terminology right, but the opiate-based prescription drugs and heroin use in Orange County. So let me introduce our first guest here, Nicole Brown Flom, yes, Laguna Beach resident.
Correct.
Correct. Your 19-year-old son, Taylor?
Taylor Brown.
Taylor Brown died of a heroin overdose in 2012. And for openers, I'm sorry. And are we going to be okay here, you think?
I'm going to be fine.
Okay. I guess I wanted to what kind of boy was your son?
He was a beautiful boy, blonde-haired, blue-eyed boy, raised in a very good, well-to-do family, went to private schools, went to church, and what happened was in junior high, it started with marijuana. Mm-hmm. And then we put him in a behavioral camp. And
for the marijuana use?
And behavioral, because we knew that was getting out of control. Mm-hmm. And then he ended up going through probably about six different centers. But it started with the oxycodone.
At what age did that start?
That probably started at 16, 15. And at that time, from what I've heard, because I stay very close with 100 of his addict friends who still use, it got too expensive for them on the streets. And then all it took, but it was the oxycodone that started it, or the Oponum, but mainly I've heard oxycodone. And then all it takes is for them to someone introduces them to smoking heroin.
And that's where it starts.
And they smoke heroin, and it's cheap. And then they vow never to get on the needle. Mm-hmm. And then at one point, they just someone introduces them to the needle gently. And you can get like a $6 bag, $10 bag. And once they hit the needle, it's no going back.
Your son hit the needle as you?
Yeah, he was on the needle for a long time, and he would tell people and his friends never to use alone. He actually did deal. He was out on the streets. He lied. He stole quite heavily. But I did find out that he was one of them that would bring people on to shoot up. Mm-hmm. And he would say, I make a vow to them. They said never to use alone, because you're going to watch your friends overdose. You'll overdose at one point. And all of his friends, when they came to my son's funeral, about 150 of them, and most of them probably were high, they were crying. And
at the funeral?
At the funeral. And they just said, I can't tell you how many times Taylor saved my life in an overdose. And it turns out that there was some foul play where he was found dead in a public bathroom stall. It turned out that looks like some of the friends dropped him off, and because the way it was staged, and it was hard. The first thing I wanted to do was call the coroners, and the coroners told me, you can't see your baby for 8 days. It's under investigation. And that's when I had the funeral. I've stayed very close with all of his friends who currently still use, and I watch them try, and then they go back, and then try, and go back. And I dread going on Facebook because I see rest in peace, R.I.P. all the time. And it's heroin now, and it's an epidemic.
And it's an epidemic. He died of a heroin overdose?
Correct.
And it was injected?
With a needle.
Yeah. Also in the room, we have James Kennedy, whose son, Joseph Ryan Kennedy, died of a combination of methadone and Xanax. Do I have that correct, James?
Yeah, that's correct.
On February 4th, 2010.
Correct.
After being dumped on a trail near Camino Capistrano off the 5 freeway. There's sort of a similarity in these stories here.
Right.
Your son, I read somewhere, was a writer. Did he enjoy writing?
Well, Joey was very, very gifted, very charismatic, very athletic, very creative. Like a lot of people who unfortunately get the disease of addiction, he had a lot of tremendous qualities and gifts. But once the addiction took hold, then that became the primary focus.
I asked a question about his being a writer because I'm curious as to whether he's ever written about his addiction.
I have volumes of writings from him. He was a more or less poetic in his writing. I think the kids today call it rhyming. And so I have stacks of journals of writing, and there was a lot of pain in those writings, no question about it. Because, like most addicts, when you take that first drink or drug, you never know, okay? And in his case, he became addicted. And then it's like trying to chase that high, but you never achieve it. And so then it becomes very pain-ridden, and you become a slave to your addiction. And so, and this is the case for basically every one of them. I mean, your addiction tells you what to do, and you do it. And so he had a lot of pain in his writings. Yeah.
Could you describe a little bit for us? You did to me on the phone the other day the circumstances surrounding his passing.
Yes, he like a lot of addicts wound up in jail. He OD'd on heroin, and when they called the paramedics, he was in the Starbucks. They called the paramedics, and the paramedics came and revived him. And basically, what happened was, after they revived him, they called the police because he had drug paraphernalia on him. And so the police, rather than taking him to the hospital, since he just OD'd, they took him to the jail. This is what they do. This is how the disease of addiction is treated. This is the problem.
Right.
Okay. So they take him to jail, and he spends a week or so in jail. In the interim, though, he had just gotten the prescription of 75 methadone and 30 Xanax from a dirty doctor in San Clemente. And
a dirty doctor is what?
That's a doctor who sells prescriptions for profit.
Okay.
They don't have they don't care about the welfare of the patient. They're just looking to see how much money they can put in their pocket on a daily basis.
Okay.
And so, so they took him to jail. He got out of jail. He got out of jail with some people he didn't know. Okay. They gave him his prescriptions back.
The jail?
The jail did.
Gave him his prescription drugs back.
Right, because he had his name was on it.
Okay.
So they gave him back to him, and within 36 hours, he was dead.
And this methadone and the Xanax, those were used for what purpose? Were those used as some sort of treatment of a previous addiction? Or
No. He went to the doctor. I have all his medical records. He complained that he had some pain. He had some shoulder pain. He had some jaw pain. He had some knee pain. And this is what happens. You go in there, you fill out a little form, and then you say, hey, I have some pain. And it's on a scale of 1 to 10. It's 5, 6. And then that gives him, the doctor, he takes his blood pressure or whatever, and then he writes him a prescription. He's in there for 5 minutes, he's out.
And he gets what he needs.
He gets what he needs. He got the drugs because he's an addict.
Yeah.
Okay?
We was
an addict. He's not anymore.
We had a 911 call
Correct.
that was received or sent, I guess, by the people who dropped him off by the side of the road.
Correct.
But they weren't there at the time.
No, they dumped him. He was alive. Ironically, they dumped him under a sign that says no dumping. It's right off the side of the Camino Capistrano Road, adjacent to or parallel with the 5 freeway going south. They then went to the Jack in the Box, which is in Mission Viejo, and they made a 911 call. The 911 dispatcher, the kid very quickly told him where Joe was, and the 911 dispatcher said, are you there with him? And he said, no. And then the dispatcher said, are you at the Jack in the Box? And he said, thank you, and he hung up.
What's the address? It's not an address. He's on a bike trail, Old Town Lawn Road by Juniper Fair.
Okay, wait. He's on a bike trail?
Yeah.
Okay, Old Town Road
Yeah.
in Juniper, Sarah?
Uh-huh.
How far up the bike trail is he?
He's just laying in the gravel.
Okay, will they be able to see him from the street?
Yeah.
Okay.
Back by the houses on the old road.
Old Town Road,
Yeah.
Juniper, Sarah. I'm not showing those as crossings. Juniper, Sarah. Are you calling from the Jack in the Box there?
Yeah.
In Mission Viejo?
Yeah. Thank you.
Okay, can I send him to that Jack in the Box, and will you be there? Hello?
I think you disconnected.
Okay.
Are there, I don't know how to phrase this, so forgive me if I don't phrase it perfectly well, but is there a type of young man or young woman who is more likely to take these types of prescription drugs that will lead to the heroin, or is it just the drug itself that sort of gets them hooked into that system?
Well, I believe that anybody who abuses an opioid, regardless of what your propensity is, if you abuse it, you're going to become addicted to it. You're going to have withdrawals.
Okay.
There's no question about it. You know, alcoholism is a different story. Alcoholism, I mean, 2 out of 10 people who drink will become alcoholic.
Right.
If you put 10 people in a line and they took opioids for a period of time, they'd all have withdrawals. Every one of them.
Now, what I've seen is that usually the ones who do get addicted, you ask, what is it
Yeah.
a certain type? What's so sad is that usually these guys are so, they're creative. They're brilliant.
Mm-hmm.
I would say an opiate addict is usually very charismatic.
Mm-hmm.
They suffer, all of them, from rapid cycling minds, but all of them will say that they have dealt with depression and anxiety before. So I do believe that there are, when you have a child who has ADHD or has been diagnosed with depression, bipolar, or anxiety, that they do turn to the drug to get them where they can feel normal inside of their head, and then the vicious cycle goes where they can't stop.
Yeah.
So it's a certain breed.
To the families or parents who may be listening, who may have concerns about their own children, is there some little bit of advice you can offer them?
I would say definitely do a drug test. You can easily go to CVS, and they have one specially made even for oxycodone. I am an advocate of treatment centers. I do believe also that this does start off with marijuana.
Okay.
I do believe marijuana is a gateway drug. That's my personal opinion.
James, you agree with the marijuana call, and is there a bit of advice you can offer parents?
Well, yeah, I
listening?
mean, I think it's not only marijuana, but it's alcohol. I mean, alcohol is very accepted in our society, and it certainly is is a gateway drug. The advice I would give a parent is, first of all, if you think your child has a problem with drugs, chances are he does.
Okay.
And if you think that, then you have to take action, and quick action, because the drugs will get a hold of them very quickly. And once that happens, then it's a real struggle, and it will be a struggle for a long time.
We handle everything from general corporate formation, partnership, real estate. We have a full-service litigation practice, and we also have a group of lawyers that handle bankruptcy and general insolvency matters.
We offer big firm experience with a small firm feel.
The person that you're hiring is the person who's going to be representing you throughout your entire map.
The slogan of redefining full service attempts to capture two things. One, an explanation of the breadth or the diversity of the legal services that we provide, but also to recognize that our service to our community does not end with our legal services.
Whether it's a pro bono opportunity where we're representing people for free, or whether we're actually volunteering on a project like Habitat for Humanity, for example.
It includes the philanthropic efforts, the volunteering of time, and the donating of resources outside just the four corners of this law office.
Okay, you're listening to KX 93.5, Laguna's Only FM. I'm Scott Hayes, and This is the Friendship Show, and in the studio now we have Natalie Costa, producer of Behind the Orange Curtain, a documentary about the prescription drug problem, the heroin problem in Orange County, and how this is leading to overdoses. Yes?
Correct.
This documentary you made sort of focused on the so-called epidemic that was mentioned in the previous portion of this show. How bad really is the problem in Orange County, and why Orange County?
Well, Orange County is not much different than any other county across the country, but based on coroner statistics, we can pretty much safely say that we lose one life every couple of days from prescription drug overdose in Orange County. Mm-hmm. And what we found is that the age of experimentation starts in the middle school era. Mm-hmm. So between 10 and 15 years of age, they start with weed and alcohol. Somebody amps it up a little bit, takes it to the next level, throws in a few pills, and they're messing with synthetic heroin, OxyContin, oxymorphone, Opana, Vicodin, Xanax is a big one with the kids, and these are addicting drugs. And as they said in the last segment, they can't afford these pills. They're about $1 a milligram on the street, where a balloon of heroin is $6.
What do you see as, based on some of the research you've done for your documentary, what do you see as some of the solutions available to sort of curb what appears to be an epidemic in Orange County?
I think, first of all, parents of children in middle school need to start having conversations about this. Because it's too late once you realize your child is out running around partying and coming home high. Just say no doesn't work. I think that when you recognize, look, I say this, if we were having a flu or some epidemic that was going to just swarm into your town and take out all of our children, parents would be rushing to the doctors to get them vaccines. Well, we have an epidemic, and the vaccine for this epidemic is education and information. And denial serves no one. I mean, it's too late to say, oh my God, I wish I knew, I saw the signs. Once they're running in that addiction process with an opiate, there's two choices: either you get clean or you die. And it's that severe, and it destroys not only the addict but the family, and it's horrific. So you have to start early. You have to start talking about this. You have to stop being sympathetic towards Sylvia or someone who lost their child, and understand that they were good parents and did everything they could to raise their child right. And if it happened to them, it could happen to you, me, or anyone.
The OC, baby. I love living here.
Orange County is a fantastic place. The natural beauty in Orange County is unsurpassed.
There is tremendous wealth here, no doubt about it.
Everybody thinks Orange County is the place to live. It's like the perfect world here, but that's on the outside.
A lot of calls involving teen prescription drug overdoses.
On the inside, it's a different story right now. It's an epidemic.
It's actually becoming an epidemic.
I wouldn't have thought in a million years that I would have had a son that was addicted to drugs.
First time I did prescription drugs, I was 13.
I started drinking when I was like 12 years old in 6th grade.
I was 12 years old when I started getting involved with drugs.
Started going to raves and doing ecstasy around 18, and then I was just spiraled out of control from there.
There's the parents that have done the drugs, that know about the drugs, and there's the parents that are the squares that have never gotten high in their life, and they have kids that are on heroin. How are they supposed to know if their kids are on heroin? Unless somebody tells them, or they get a phone call that says, you're gonna have to come down and identify your son.
When I was in the coma, I couldn't walk. It was hot.
This is my sister Jessica Silver's ashes.
And I've been to 13 funerals in the last whole 12 months.
6:59 a.m., they found my son, face down, laying in the dirt.
If you could go back, would you use drugs, alcohol, or marijuana, Aaron? One for yes, two for no.
I don't want to tell you the truth, because when I'm active in my addiction, I don't want help.
So I'd like to introduce our next guest here. In the studio we have Dr. Lenny Flom, who, along with his wife Nicole, co-founded Laguna Beach Recovery, which is a treatment center that specializes in heroin addiction here in Laguna Beach, correct?
Yes.
Okay, Lenny, thank you for coming in, by the way. I
my
really
pleasure.
appreciate
Thank
this.
you.
So let's start with what's so appealing about these prescription drugs and ultimately heroin. Why are so many young people being attracted to these sorts of drugs? It's not like the 60s where everybody was smoking marijuana. It's something else that's going on here, and I'm wondering if you can help us sort of explain that.
Mm-hmm. You know, I think a lot of it starts with some peer pressure.
trying to fit in.
Mhm.
Kids are very vulnerable. I deal with these young kids on a daily basis, and they're just wonderful, brilliant, creative kids. But I think it's peer pressure. I think a lot of it also is today, parenting has changed a lot.
Mhm.
I think that there's underlying emotional problems that are sometimes recognized, but kind of pushed to the side. The problem, many times, and it's my opinion, is not necessarily the heroin addiction or prescription drugs. It's the underlying emotional problem. It's the depression or the anxiety, sometimes bipolar disorder. You've got to get to the root of the problem. Why is someone turning to that?
So that was going to be my next question. How does the program work, and what are some of the techniques or therapies that you're using that seem to be effective in treating the addict?
When our patients come in, one of the first things that we do is, we assess them and we talk with them and get to know them and their family. And the next step is generally we send them to Dr. Kaufman, who is able to, accurately begin to, assess and determine if there's some underlying emotional problem that needs to be treated. And, he's very careful about how he goes about it. And then our clients begin to work with a treatment team.
Okay, so let's introduce Dr. Ed Kaufman, who specializes in addiction psychiatry. You're the medical director at both Laguna Beach Recovery and Northbound. Do I have those correct?
Correct.
And I guess let's start with some of the causes for addictions, and especially in young people, and especially Orange County, if you can address those.
Well, there really is a multiplicity of causes. And one of the first causes is actually genetic. I mean, if you have a parent who's an alcoholic or has abused pills themselves or has any kind of genetic predisposition, even a grandparent with drugs or alcohol history, then you're going to have a tremendous predisposition yourself. And then in terms of parenting, I think Aristotle was right about the golden mean. So the issue is not, in general, overindulging. The issue is if a child is raised in a family that's too strict, they're going to be more vulnerable. If they're raised in a family that's too lenient, they're going to be more vulnerable. If they're raised in a family with overwhelming, all-encompassing love, they're going to be more vulnerable. If they're raised in a family where there's emotional distance, they're going to be more vulnerable. So the family factors really are at the opposite ends of the extreme that contribute to this.
So, I mean, genetics you can't control. The parenting you maybe can control, but as a child being raised in that household, you certainly can't control it. And we're not blaming parents, certainly, for the addiction problem in Orange County. Are there any other causes to that child over here who doesn't turn to opiate-based prescription drugs or heroin, and that child who does?
Well, Lenny's alluded to the fact that, anxiety and depression, bipolar disease, that all of these clinical entities, as well as subclinical entities, people who have difficulties with attention and focus, and somebody gives them a Ritalin or an Adderall, and very often, especially if it's not carefully supervised, they're going to be on their way. Or an anxious kid smokes a little marijuana, even in middle school, and he finds his anxiety goes away, or his depression, or even the issues with attention and focus can be temporarily helped by a drug like marijuana. So I think those first experiences with drugs are often, when they relieve anxiety and depression, really lead the individual down the path. There was talk earlier in this show about marijuana being a gateway drug, alcohol being a gateway drug. Well, cigarettes are also a gateway drug. And I think that the importance of peers can't be minimized. Even looking at who your child is playing with when they're very young, and taking a look at them and their families, and just trying to steer your sons and daughters to hang out with kids who are going to be supporting each other to lead meaningful lives and supporting each other to not use drugs and alcohol.
We handle everything from general corporate formation, partnership, real estate. We have a full-service litigation practice, and we also have a group of lawyers that handle bankruptcy and general insolvency matters.
We offer big firm experience with a small firm feel.
The person that you're hiring is the person who's going to be representing you throughout your entire map.
The slogan of redefining full service attempts to capture two things. One, an explanation of the breadth or the diversity of the legal services that we provide, but also to recognize that our service to our community does not end with our legal services.
Whether it's a pro bono opportunity where we're representing people for free, or whether we're actually volunteering on a project like Habitat for Humanity, for example.
It includes the philanthropic efforts, the volunteering of time, and the donating of resources outside just the four corners of this law office.
Can you clean up an addict's body and mind and spirit? Is that a possibility?
Absolutely.
And that process works how? Is it a 12-step program? Is it some other sort of intervention? Is it the use of other types of meds that gets them off?
I think that it is based on every individual is different, and you need to take the time to get to know that individual. You know, like everybody has a different DNA.
Mm-hmm.
And so we treat, you know, the people I treat, everybody is different. And I take the time to get to know them. And when you do that, you can now start to go down the correct path. You know, the people we treat on day 1 are not the same people we're treating on day 7.
Mm-hmm.
So our treatment, I've developed a formula that has been very, very successful.
Mm-hmm.
And it is a different and new methodology. I mean, that's why I opened Laguna Beach Recovery.
Great.
And also to give back. I have it has nothing to do, it's not a business to me.
Right.
It's more of a mission and a passion.
Dr. Kaufman, can you treat drug addiction problem with drugs?
You can treat it with drugs, but it's only a small piece of the treatment.
Mm-hmm.
Any treatment for a drug addict has to be totally comprehensive. You have to look at the spiritual, you have to look at the metabolic, you have to look at diet, you have to look at exercise, you have to look at the spiritual. The most successful treatments combine all of these. The 12-step program is the best thing that's ever come about. It's treated more addicts and alcoholics successfully than all programs put together. But there are some people that need other things. Some need therapeutic community, some need intensive psychotherapy, and some need medications to get sober and stay sober.
Beautiful. Yeah. Thank you both for coming in. I really appreciate your time and sharing your information and knowledge with us. Lenny, especially you, my friend. Thank you very much.
Thank you, Scott.
So you've been listening to KX 93.5, Laguna's Only FM. I'm Scott Hayes. This, of course, is The Friendship Show. I want to thank our guests this morning, Nicole Brown-Flom, James Kennedy, Natalie Costa, Lenny Flom, and, of course, Dr. Ed Kaufman. Thank you both. And April, take us out of here, please.